Hey everybody, in this video we want to talk about how does chiropractic work to eliminate headaches. So I'm going to keep it simple. I'm going to use a couple posters behind me to help illustrate a few things. One of the things we're noted for in this office and what we specialize in is paying particular attention to this area, which is known as the cranio-cervical junction. That's technical speak for where your head and neck come together. But there is a very rich bed of neurological and vascular activity here that are often correlated not only with headaches, but a lot of other health problems. But what can happen is you've got a 10-pound head sitting on a 2-ounce bone. This would be about actual size, and your head is sitting on these two little peanut-shaped joint surfaces. So we're kind of like one of these bobbleheads. So it could be even from a stressful birth process to learning to walk and falling down, hitting the head on a coffee table, bicycles, skateboards, sports injuries, car accidents, and everything from when you were born up until this day that could ultimately shift and misalign and put stress in this area of your spine, okay? The challenge is actually assessing this properly. You have to do very specific evaluations and very precise type of imaging just to properly see the misalignment. And in order to fix it, you have to be able to see it. So that's what we do here. Now, in terms of how does that help headaches, when you have a misalignment here, it can create a whole cascade of things, most of which you're not aware of. But obviously, if you're having headaches or migraines or maybe neurological symptoms, you're going to know that these things are being affected. So number one is spinal cord tension. Okay, you have little ligaments that suspend your spinal cord inside of your spine, which can put tension on it, right? And then it puts abnormal tension on your spinal cord itself. Venous drainage, arterial supply. So now we're affecting blood flow into and out of the brain, okay? So if you look on this model spine here, this would be the neck and this is the base of the skull, and you can see the blood. You've got blood vessels, vertebral arteries that run through the vertebrae along the side of the neck and then up to and feed into the base of the skull and the cranial vault. So misalignments in the spine here can actually affect, again, blood flow into the brain and venous drainage out of the brain, which can certainly create headaches, again, and other neurological type issues. Then there's also cerebral spinal fluid flow, which is flowing into and out. That's what's nourishing your brain and pulling toxins out. You can affect your balance, create stress, obviously pain, and altered function. So again, we're kind of focusing on headaches here, but it can create a whole host of other neurological issues, dizziness, balance, vertigo, those types of things, okay? So the other thing we're gonna notice when there's a misalignment here is the nerves that control your postural muscles all the way down to your ankle are emanating from this area of the spine, okay? So interference to those signals can distort your posture and balance, which is one of the reasons we check that during an evaluation, all right? And as you can imagine, this is gonna pull, it's gonna pull your knee, hip, and it can create obviously hip pain, back pain, neck, shoulder pain. So if you have accompanying, shoulder and neck pain, headaches at the top of the list here, this is what an upper cervical misalignment will do. It's not that we're ignoring the rest of the spine, but at least as it pertains specifically to headaches, we want to look really closely here, okay? So once we correct this misalignment, this will all balance out. So your nerves will actually balance how your muscles are firing, which is then going to balance your spine. And once we take that tension off the spine, it's going to take and reduce tension off your discs, off your supportive ligaments and other connective tissue, which ultimately, once all that happens, it's going to culminate in reducing inflammation around the joints, okay? And inflammation was almost always causing pain and certainly causing or contributing to headaches. So hopefully that makes sense. Just in a nutshell, we gotta find out, do you have the misalignment? How do we need to correct it? Do specific correction, balance the spine and nervous system, which balances your muscle system, takes stress off the discs, joints, ligaments, other nerves, and then the body will heal and correct itself. So it's really simple in one hand and a little more complex in the other. If you'd like more information or if you want to find out if we can help you, again, please feel free to call our office. You can schedule a complimentary consultation. We'd love to help you. Again, I'm Dr. Todd, Mount Dora Chiropractic. Have a healthy and blessed day.